Welcome. Today, my very special guest is a doctor that has been on my podcast before, has been on my online trauma summit before. And I always believe that there's so much more to the conversation with this individual that I brought her back on again. I want to introduce Dr. Susan Fox. Dr. Susan has her doctorate in acupuncture, traditional Chinese medicine, and her specialty is women's health, especially infertility. And she is the CEO and founder of Health Youniversity. And looking forward to the conversation, Dr. Susan.
Thank you, Dr. Irene. It's so nice to be here. I really appreciate spending the time with you, and I'm sure we have lots to get into.
Absolutely. So, Dr. Susan, I know that this is an area that you're very, very passionate about, and perhaps only affects a segment of our total listening audience, and yet greatly impacts everyone in our listening audience, and that is fertility or lack of, and the ability to bring healthy, happy, adjusted babies into this world. And so want to talk with you and to our listeners who are perhaps our faves, our high achieving women who want and need and frankly deserve to have it all. They deserve to have the career, the success they want, the personal life they want, the health they want, and yes, the children that they want, because there's something about, a growth journey when you have children. And not to mention, where would the world be if we all stopped having children? So this is an incredibly important conversation. So I want to start out, just jump right in and ask, in your experience, who are the clients that are coming to see you? What's going on in their lives?
Well, I will answer that question, but I just want to ping something that you just said in terms of that infertility. And I kind of somewhat challenged that word. I like to use the word subfertility is most often what's happening. And we'll get into the reasons why. But it is now known to affect 1 in 6 women globally. Here in the States, it's 1 in 5 women. So it's a big deal. It's something that we really all need to be aware of. And it's something that we can actually make beneficial changes to our health and therefore our reproductive health and therefore our progeny. But to answer your question about who is the typical woman, she is typically very successful, very well educated. She's gone through undergrad, oftentimes postgrad. She is either sort of CEO or a team leader in maybe the high tech industry, or she is a medical doctor herself and went through the 9 years postgrad training. And so some components of her fertility challenge is that she's just needed to wait until some of these other accomplishments took place. And then she has this, oh my goodness moment of, I forgot to get pregnant. And time is a factor, but more often than not, I think the factor is that the stress that she has learned to live with and has presumed to be normal. And it's become normalized for her, but it is not natural, innate within her.
Again, thank you so much for the pinging. I love the phrase subfertility. In other words, it's just not optimal. And as you know, I'm passionate about everything being healable. So whether we have the answers right now or not, I really do believe that our bodies have the ability to heal themselves, maybe with a little guidance and some interventions. And
Absolutely.
right. And I appreciate that you brought up, yes, waiting is a factor. Absolutely, because if we're going to have that career, that the success that we want, it's really challenging if we decide, right off the hop, it's like, oh, I need to have my babies first, because chances are our lives will get derailed after that. It's really challenging to go through med school with children.
You speak from experience.
I was there. I did it. I know. Same thing, to climb the ladder of success or to be that entrepreneur. it's
doable.
it's doable. Absolutely.
That's just a whole different arena of stress that it brings.
Yes. Gray hairs. Yes, absolutely. But you mentioned stress, and especially the fact that they have come to think of it as normal and necessary.
And in some ways, it actually has been necessary. I mean, it has proven itself to be true that these women, and I'm going to use the term women, people, need to work harder, longer, in order to make their way into the realm of success more so than possibly their counterparts. So it has been reinforced that this level of stress is a requirement when, of course, we know it doesn't really have to be, but I in no way wish to diminish the experience that it almost feels like it has to be, if that makes any sense.
Oh, absolutely. And that is one of the things that we teach in the Institute is where glitchy programming comes in. And the glitchy programming may be from your parents. Like in my farmer family, the message was life has to be hard. Life is hard. Life is not fair. Suck it up, get used to it, and keep soldiering on. Right. So it could be some version of that. It can also be cultural, right? Since you and I are both doctors, I'll pick on that, like what I call the gauntlet mentality in the training, which is, you got to prove that you got what it takes, and your needs, your health matters like zero, because we did it and you can do it too. I've seen it in lawyers, right? Tech is infamous for this, right? It's like, because you can be replaced on a dime, or at least that's the fear, right? Which then brings up the next thing, is that maybe it's an unconscious fear that I have to keep proving myself. I have to be the best, or I'm not going to be good enough.
Yes. I think it is a blend, if you will, of many factors that have kind of woven their way into the fabric of our psyche that has us believe that we have to work harder, that we have to postpone our fertile health in order to make our mark and our legacy in the world. And I want for every person to make her mark and legacy in the world. That's what we came in to do. But as you and I had said off camera, we can have it all. It does not have to be just one step at a time. And it takes a little ingenuity, but I think we got that as well.
Absolutely. And as you know, our mission statement with the Success Shift Institute is essentially that we are on a mission to help all of our mission-driven individuals have it all. They can have the ultimate success and impact. Impact, right? That legacy vision.
That's the word, legacy.
Legacy. In other words, they can leave their legacy without sacrificing their health, their relationships, their personal life. It does not have to be either or. You can truly have it all. I think there gets this thing about work-life balance. I hate that phrase. I really hate that phrase. And it's because most of the time it implies that you have to dial it back.
Right. Or that at any one moment in time, everything should be evenly distributed. And that's not how life works. Life, homeostasis doesn't work that way. There's an ebb and a flow. So at some points, perhaps the work is going to take precedence. And then at other points, perhaps the self-care will take precedence, as long as there's room for both. And I'm making hand gestures because it really is the wave, the yin yang, the infinity symbol, that we are made of that stuff as well. So we really want to just have an awareness and have a consciousness and have a commitment. And then therefore sometimes have to put in a little sort of disciplines, if you will, practices that remind us that yes, while it may be 70% work today and 30% self-care, let's have tomorrow be 70% self-care and 30% work, so that we can get that balance back.
Absolutely. And again, one of the things that we teach at the Institute is how to work smarter instead of harder. And I will say I learned this from my farmer father. because he was the epitome of this. That man at 80 was stronger and could do more than most men half his age. But he did it smart. He was like the ultimate MacGyver, for those of anyone that remembers that show. I called him MacGyver, like, because he just had this way of, he would just kind of like stop and step back and look at a situation and go, what's really needed here, rather than barreling in as we so often do. So what we've found is that by using the tools that we teach, people actually get more time back. They get more energy back. And that way they have more of the ability to have it all, right?
Indeed.
Exactly.
And it does, I'm going to get a little geeky here with your permission. Because it really does change the physiology. It changes the hormonal patterning. It changes, as I had mentioned earlier, even the quality of the follicular fluid within which that egg is living and growing. So under stress, there is evidence that that follicular fluid, under persistent chronic stress, that tends to lead to things like metabolism imbalances and weight gain, all the way to obesity. That is our other sort of sister epidemic, if you will. Now we've got the glutides and all of that, but that's another conversation. But that follicular fluid will contain elevated insulin levels, elevated inflammatory markers, elevated fat in the follicular fluid itself, elevated triglycerides. So to be able to make these changes that your institute offers, it's not a vacation, if that makes sense. It's not a like, let's have this respite and breathe deeper and feel better. It literally is changing your body, and it's changing your potential baby's body.
Absolutely. Changing the neurophysiology, the hormones, the chemical messengers, all of that you and I love to geek out on. And I appreciate especially that you know this, and you've actually taken our Elite Performance Amplifier course, so you can speak to this. And this is not meant to be a plug. It's just talking about, I appreciate that you felt the benefit so strongly that you then commissioned me to,
I was about to give you that plug.
to create the content for you.
Yes,
right? For your courses. And I was honored to do so because it is so necessary. And so we've had this conversation go back and forth in so many ways, talking about stress and trauma and how that impacts our women with subfertility. I want to take a step sideways because much as I love to talk about stress and trauma and how to shift into healing mode and successful fertility mode, we can say, and success mode in your career, traditional Chinese medicine, acupuncture, is all about the flow of your life energy, your qi. And while I'm not to your level in it, I do have a background in it and appreciate that disease, so-called dis-ease, is considered to be a blockage of your life energy. So could you please look at subfertility with the lens of traditional Chinese medicine and how that would show up? Let's give our listeners a taste of that.
Sure. Well, I think I'll overarch it by saying we are nature. We just, we're not the flower, we're not the tree, we're not the blade of grass, but we are nature. And so therefore, similarly as to what happens in nature is happening within us. And we may have constitutional tendencies that have a particular aspect of our nature be more prominent, prevalent, and therefore be more likely to go out of balance. But for instance, I like to use the 5-element method of interpreting what's going on. The 5 elements of Chinese medicine, they are water, wood, fire, earth, and metal. And so I will ask questions that really help evoke where this person may be tending to going sideways, when things are a little bit out of harmony. So the wood element person, when things are going sideways, she will tend to be a little bit more stuck, stagnant, maybe a little bit more irritable, or have mood lability, and or have PMS kind of symptoms, because there's so much energy that is being inappropriately contained, suppressed, oppressed. So when I see those kind of qualities, I say, okay, we have to help you soothe that chi and smooth that chi and move that chi, so that all of this life force, this creative potential, gets to then sort of move and fill up what has then become deficient, and smooth away what has become excess. And this can be done in the privacy of your own home. The four pillars, I like to call them, of the proper nutrition for that person, the proper hydration, and we all have similar hydration needs, the proper circulation. That person may need to have her dance party in the living room, whereas another person may need to do restorative yoga, depending upon what her Chinese medicine constitution looks like. So that's a very brief description. I can go through all the elements if that's of interest, but
I love this idea. And so let's just touch on wood here for a moment. And that you said the nutrition for her, the movement, the exercise for her. So if you wouldn't mind, could you give like a brief overview? So let's see if our listeners can figure out which they might fit into.
That's what I was thinking. Yes, that's what I thought. Maybe if I just offered a little view of each element, you might be able to identify yourself. Like, oh, yep, that's me. So as I say, that wood element, she wants to create. So when her energy is being suppressed, she's going to have difficulty creating, and she's going to have this sort of overabundance of energy that needs to move. The next element that wood energy would generate, we use the term generating sequence, would be the fire element. And that person is the life of the party. She's got a very sort of almost a melodic voice. Everybody sort of feels a little bit more uplifted when she's in the room. But when she is either overworked or is feeling kind of sad, that natural joy for her will get a little manic. She's going to be the one who says, oh, everything's fine, nothing's wrong. Whereas it's visible to the person listening to her that everything's not fine. And she just needs more of the calming, soothing, cooling energies to bring her fire energy sort of back into harmony, so that her joy can be this, lovely, comfortable expression. And then she's more apt to be open to what nature, pouring the vacuum wants to infuse within her. The earth element is the person who is very thoughtful, pensive. She's who you want to go to with a problem sometimes, because she's going to listen, and then she's going to sort of almost digest. I guess that's probably the key word. She's going to digest, because that earth element does have to do with our digestion. And when our digestion is off, whether it be from poor eating habits or not eating, including not eating, then her ability to digest and assimilate and eliminate toxins efficiently will become impaired. And so she's the one who's going to end up with a little bit more metabolic dysregulation, perhaps weight gain around the middle. Perhaps she's the polycystic ovarian person who then is having difficulty with regulating her cycle. And that's because this accumulation of energy has not been digested, assimilated, and eliminated well. The air element person is one for whom she is, how shall I say this? She is inspirational. So the wood element is this sort of creative force. The fire element is the life of the party, but the metal element person is really she's inspired. She's somehow like collecting things from the other side, if you will. She's very intuitive, and she will bring these inspirations into fruition, into reality, as all of her elements, because we are made of all of them. We just have our predominant, but she'll be able to bring this into reality using her wood energy. That her, I guess, front and center purpose in life is this inspiration. When things go a little sideways for her, it can manifest with things like immune issues. Like she could be quick to catch the colds, flus, things like that. Rash issues, because skin issues, because That is our immune barrier. Our first immune barrier to the outside world is our skin. So things will manifest on our skin. And emotionally, she can collapse with grief. That is, sort of the lungs. We see it. We see it if we see someone whose loved one has passed. There's a little bit of a collapse with the grief, which is appropriate for a time. But when there is this undue amount of grief and collapse, literally her chi caves in on her. So she would do well to take a walk in nature and really breathe in deep the energies that want to fortify her. And the fifth element for our conversation is the water element. And that person, she has a deep wisdom, slightly different from inspiration, right? Inspiration is like, wow, that was a great idea. The kidney is the organ system that is associated with the water element. And it's as though her wisdom is deep in the ocean. It is always abided and it'll always be there. But like the ocean, when things are going smoothly, she's seemingly calm on the surface while she's full of this wisdom. When things go a little sideways, the waters can get very turbulent and then it can actually get a little murky and muddy. And she will then find herself emotionally in a state of fear, like that dreaded fear of, oh God, when's the other shoe going to drop? And physically and physiologically, this person will have a pretty quick adverse impact on the water pathways of her body, which include our hormonal signaling. They run along our water pathways. So that's just a little brief synopsis of how we can perhaps identify ourselves. Like I, for instance, can be predominantly earth element because I can sometimes be too busy to allow myself to really assimilate, digest, eliminate efficiently. And so therefore, the wood element that is also a big part of me that wants to create is a little compromised because all of these things need to be fortified enough so that they can support our life's purpose.
Thank you. I hope our listeners got a little glimpse into who they might be. And I appreciated that you showed both how when you are working it in the positive and when it's out of balance. And it's understanding there's no right or wrong. The out of balance is when life happens or when you are in stress or survival mode right. So in other words, it happens to all of us. So you're not, stupid or lazy or lacking willpower, nothing to be ashamed of or guilty that you get this way because we all do.
Exactly. That's the human experience. If someone were to say they didn't, I would be concerned for that person's real ability to have self-awareness, or is she locked in a closet somewhere?
Absolutely. And this is a really great point because so many of our clients are stressed overachievers that really, because of whether it's past trauma or past programming or those unconscious fears, that they feel like they have to give until they're bled dry, that they have to be perfect in order to just be enough. And then there's this shame or guilt because they feel like a failure. And then the subfertility, to use that phrase, can just be one more thing that makes them feel like a failure.
Correct.
Right.
Yeah.
But that's actually throwing them more out of balance.
Mm-hmm. And I actually perceive this as these are just messages, right? Our symptoms are messages that say, knock, knock, something's off here. Would you like to fix it? And oftentimes we ignore that knock, knock until it's a bang, bang. And then we're kind of on our heels a little bit. But yes, we can restore our whole health, our emotional health, our physical health, and our fertile health just by giving it really a little bit of time. I mean, our bodies are amazing and our brains are amazing at saying, oh, you want this? Okay, we'll get started. So in as little as 4 weeks, we can see a change. And I think, if I may, I just had a thought that I want to make sure that the listening audience doesn't have this moment of, oh my gosh, it's too late, because it really is never too late. But if you are listening and you are sort of saying, okay, now is maybe not the time that I want to have children, but I would like to have children, I really want to encourage, just get your labs done. Take that worry out of your brain, because you'll have a baseline marker that will say, okay, I'm good. I can hang out a little bit, or speak with a specialist who can kind of give you some guidance, because that's been the most painful part of my experience in clinic, is that these high achieving, incredibly successful women will sit across me and say, how did I not know this about my own body? When it's true, we ought to have been taught this at fourth grade. It's not difficult. It's just that we don't know what we don't know. And so I think I want to just encourage, education as empowerment.
Absolutely. And speaking of education and empowerment, can you give some insight into Health University and how you are helping women there?
Well, I'd be delighted. As you all know, I could talk about this all day long. So, Health University was born of my observation that the need was greater than my ability to fulfill in my clinic, beyond my zip code, beyond the state lines of my licensure. So, I designed this program that includes US faculty to allow people to really make many changes in the privacy and comfort of their own home. So, for instance, we use acupuncture meridians, but we use a TENS machine. We call it TEAS, transcutaneous electrical acupoint stimulation, with videos on placement. So, we're targeting blood flow at specific times in the cycle. We use LED infrared as well, because we want to give the body enough slightly different pieces of information or suggestions so that it doesn't adapt and say, oh, I'm lazy. I'm not going to keep doing that thing that you asked me to do. And then we address the mind body with your work, because we use the guided meditations, 5 videos over the 4-week menstrual cycle, the 5 phases, so that we know, not intellectually, but we know within our bodies and minds and spirits what's happening, and we can engage with it, because in so doing, we're actually improving the natural circulation, if you will, as to what's going on. Are follicles growing? Are follicles about to ovulate? Has conception occurred? We're now in the 2-week wait, so that we really can engage and not feel like we have to run away from and cross our fingers and hope and pray and then be devastated at the first drop of menstrual blood. We use Qigong videos as well, because Chinese medicine, that is a form of movement. You don't have to only do Qigong, but I advise you do the Qigong in the series if this is something that is of interest to you, because similarly, 5 phases of the 4 weeks of the menstrual cycle, things are moving differently, and we want to reinforce what is happening within our bodies. We obviously, as I say, use the 4 pillars: nutrition, hydration, proper sleep-wake cycles. Circadian flow is critical. And then there's a coaching call if there are questions that come up, and so we can just answer in a sort of a webinar style so that everybody has the same answer, because mostly when someone has a question, more than one actually has that question. So it's a lovely, lovely way to not have to run to another series of appointments, not have the stress of having someone else tell you what's wrong with you and how to fix it, and only I can fix it. It's giving you the tools that you can fix a lot of these things yourself. And it's not just for the fertility. It's not for the positive pregnancy test alone. It's for your healthy pregnancy. It's for your healthy family. It's for healthy postpartum, because these changes will be lifelong. They really are helping you change your life for the better.
Appreciate that so much. So what I'm hearing you say is that this will help all women get pregnant and have the healthiest pregnancy, and thereby the healthiest baby as well.
And I will say, if you don't want to get pregnant, this will help you with your own fertility, because your fertility is beyond baby making. Our sort of successful hormonal flow is what gives us our health. So if you're listening and saying, this is not for me because I have no intention of having children, well, if you have ovaries and a uterus, then you probably need to know what's going on, because the hormones that are being produced are affecting your brain health, your bone health, your immune health, the luster of your skin. So while the conversation is about subfertility or infertility, this is really about your whole health equals your fertile health.
I appreciate that so much. So in essence, you could say it's for any woman who is in that age group, it's not so much an age group, a phase,
Mhm.
life phase from the start of menses to perimenopausal,
Yep. Yep. And,
right?
possible unless there's a recognizable issue at the start of menses, that young woman, mid-teens to early 20s, unless there's some evidence with symptoms and signs that something's gone a little sideways already, it's usually someone in their, I would say, mid to late 20s would be really great to kind of get this early assessment, like, how am I doing, especially if I want to have children. And then certainly I'm going to use the time frame, the 30s, which is typically when most women are trying to have children, into early 40s, when most women are thinking, I'd like to have maybe another, because secondary infertility, subfertility is a real thing as well. It affects, I think, 1 in 11 women here. And there are often reasons that were raised during her pregnancy and postpartum timeframe that just again need to be a little adjusted so that she can get pregnant again, because it's a very common pathology, if you will, to see recurrent pregnancy loss post first baby. And that's heartbreaking. And that woman also feels shame because she is oftentimes saying, I have a child. There are women who don't have a child. I shouldn't, that all over herself. We shouldn't want this badly, but existentially I do. And I say, it makes no difference whether it's your first or your second. If there's something you want and you
Mhm.
can't have it, then it's heartbreaking. It's crushing when it's something, as important to many as a baby or a sibling.
Absolutely. So, want to take a jump sideways,
Mm-hmm.
and I think of Rose in The Golden Girls. Again, for those of you who remember that TV show, picture it. Our high-powered rock star of a woman has put her, you know, her personal life on the side, has powered through, become like the ultimate that she wants, and perhaps she's getting to that stage where she's like, I need to have a baby now, or it's going to be too late. I'm doing that in quotation marks for people just listening to the podcast. And perhaps they have a specialist that says, you're not going to be able to get pregnant on your own. We recommend IVF, for instance, in vitro fertilization. What would you recommend
Mm-hmm.
for our high-powered women listening?
Right. Well, I think I would first ask, do you have here in the States employee benefits coverage for IVF? And if so, yeah, let's get you ready to do it, because that way you've got embryos that are proven to be healthy and safe and viable. And then you decide, do you want to try on your own? Because just getting that layer of stress off of each month, is it going to happen? Is it going to happen? Is it going to happen? Oftentimes is what lets it happen. And of course, here in the States, it is very expensive. So paying out of pocket can become prohibitive. So it's a uniquely personal decision. I am absolutely in favor of IVF, especially for women and couples who want to have more than one child, because, life happens and we just don't know. So it really does help with family planning. Once again, especially for the woman who you just described as, perhaps a little older, but it is natural. It is nature that her count of follicles will wane and diminish over time. They refer to that as diminished ovarian reserve. And that is where or the program, the Your Fertile Health program at Health University, comes in, because we care less about the count. The count infers the quality, the quantity infers the quality, but it's not an equal sign. So that's when we say, okay, let's go in and let's really double down on nutrition, hydration, proper targeted circulation, proper sleep-wake cycles, so that we can really improve the quality of those follicles that are coming up each month. And in a stem cycle of IVF, more than one are coming up in order to be retrieved and inseminated in vitro.
Mm. So what I'm hearing you say is to not throw the baby out with the bathwater, bad pun intended, in that I'm not saying not to do the IVF or any other fertility drug like Clomid or whatever. It's just what I'm hearing you say is that your program and what you teach will help them be more successful no matter what, and
Absolutely.
healthier. In other words, your baby will be healthier,
Mhm.
right? So,
Absolutely.
which is very, very important because I recall you telling me that it could cost something like 75,000.
It can be up to $100,000 for gleaning enough embryos to assure a take-home baby. So each retrieval cycle, by the time you add the meds and the procedures and the diagnostics and then the procedure itself, it's about 15 grand plus. Then you get the embryos, and then you have to send them off for testing, especially if you're going to freeze. You don't want to be freezing embryos that are not viable. And so that's another, 3 to 5,000. So it really just adds up. And so my argument, if you will, on behalf of myself and my program is, why not try to improve the quality of the embryos that are going to come in retrieval session number 1, so that you don't have to do possibly retrieval session number 2 or 3 in order to be banking enough embryos to feel that you've got a good chance of a take-home baby.
Absolutely. And that's not just you saying that. I know that you actually have quite a number of fertility doctors
Mhm.
who like to work with you
Mhm.
to make sure that their patients are more successful.
Right. I'm very grateful in my private practice to have this professional friendship with many of the local IVF docs here in the San Francisco Bay Area, which is a very popular area for IVF. Although I will say, I just saw the statistics that 2.5% of babies born in 2022 were IVF babies. Over 90,000 babies were IVF babies. So it
Wow.
is a growing phenomenon, and I'm all for it. My again argument is, don't run in unprepared. You wouldn't start a marathon without a little bit of training. You wouldn't, I don't know, you wouldn't go into college without having finished high school. So like, just do the right amount of preparation. And I know that there are people out there who say 3, 6, 12 months. And I understand that is the arc of time for folliculogenesis. And that would be ideal and optimal, except if you're in your late 30s, early 40s, that might not be ideal. That might be the window within which you don't have this extra time to prep, because again, in nature, the number will wane over time.
Absolutely. Absolutely. Now, for our listeners who are like going, oh my goodness, that's me. I need this. How can they learn more?
Oh, thank you. I can, the freebies, if you will,
Yeah,
are
let's talk freebies.
exactly. There is a wonderful quiz that is about this 5-element focus, but it goes into some really great freebies of, here are ways in which you can, adjust without taking the course, just to get a feel for it. And that is yourfertilityquiz.com. And it's yourfertilityquiz.com, because I think out there in the world there is a fertilityquiz.com, but I don't know anything about it. The university, YOU, Health Youniversity, is healthuniversity.co, not .com. And then within that website is the programs that will describe the Your Fertile Health program. All of those links are within the healthuniversity.co website. And once again, it's YOU University. You'll take the quiz, it will give you a report, you'll get a more detailed emailed report. Then you'll get a series of emails that just kind of elaborate a little bit on some of the statistics and then how you can help improve your fertile health.
Love
And of
it.
course,
Love
I'm
it.
always available and happy to answer questions. Caveat being that, please know that outside the state of California, I am very limited. I do have my health and wellness coaching certificate so that I can speak to people outside the state of California and not run the risk of practicing medicine without my license. But the conversation will be slightly different, more coaching oriented than diagnosis and treatment oriented.
Right. So just let it be known that this is not a doctor-patient relationship. It is a coaching relationship,
Right.
and you will still benefit infinitely from working with Dr. Susan. Thank you so much, Dr. Susan. This has been a phenomenal time with you, and I know that we could keep going because I have other questions about other phases of life And I know you have some goodies coming down the
I
pipeline
do.
as
Yes.
well.
Yes.
And so I really, really look forward to when
Yes.
you have those resources available
Yes.
for other life phases so
Mhm.
that we can have you back in and talk more.
Thank you so much, Dr. Irene. It's been so fun to chat with you. This is my favorite conversation, and I'm hopeful that it was beneficial to your listening audience.
Oh, I know it was.
Thank you.